Thank you for tuning in to Amaris B podcast. I am Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I am an MOH accredited liposuction doctor and medical aesthetics doctor based in Singapore. I have been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for basal liposuction, Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift. Also by Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. Today, I would like to share about techniques of gynecomastia surgery. Traditional gynecomastia surgery typically involves removing of glandular tissues and excess fat tissues, making your chest, breasts look flatter and smaller. So very often patients may find that how they look after surgery may not be idealistic or good enough for them. You often find that the chest is not well sculpted, it looks slightly a bit unnatural, and it's not something that they would think they would look like after the surgery. Based on years of talking to patients and treating patients, I would like to share about our novel approach technique for gynecomastia surgery. I like to term it a 360 GTD technique. For gynecomastia, my usual approach is to look at it from four perspectives. The first is to assess how big, how extensive the gland is. The approach is to remove as much as comprehensive as possible, leaving no excess glandular tissue behind. Next is to assess how much fatty tissue in the breast. The idea is to take out as much fat as possible to create an ideal shape and contour. The third is to try to sculpt the chest along the chest and the chest wall to highlight the musculature, to highlight the contour so that they look toned, lean, and sculpted based on their body shape, based on their body weight, based on their physique. Last but not least, the most important of them all is how much loose skin or not the patient has. This often is the most challenging part of surgery, and the objective is to perform the surgery in a way to stimulate the collagen, to stimulate the skin, to allow them to tighten post-surgically to achieve a toned, tightened skin, leaving no excess skin behind. Thank you for listening. I hope you enjoyed the podcast today. If you do have any questions, please feel free to send it to us. We'll be glad to answer all of them. See you again.